am very proud to be a co-signature of this, and I want to thank Senator Clonan for asking us to co-sign this particular bill, and also to thank him for his continued advocacy in relation to disability services, disability persons, and all that they are and should be entitled to. It's something that I deal with Lascahirlock on a daily basis, be it transport, be it education, be it housing provision, and obviously access to healthcare. But the Minister will be, and I want to welcome the Minister into the chamber here again this evening, the Minister will not be surprised when I once again bring up assessment of need. It's something I've had discussions with her in this chamber or in relation to commencement matters and at second stage of this particular bill, but I'm going to use the opportunity in an overall sense tonight, Lascahirlock, to raise it once again. Item number 2. 12A is the duty of the Minister to make resources available as part of this bill, and it states the Minister shall, with consent of the Minister for Public Expenditure and Reform, out of monies provided by the Oireachtas, provide such monies and other resources as are determined by him or her for the purposes of the preparation and implementation of assessment reports prepared in respect of a person with a disability. The Minister will be aware of, and it has been referenced by Senator Higgins, the massive amount of families who are waiting on assessment of needs for their loved ones, which stands almost at 9,000. She will also be aware that in my own area, CHO7, that figure is the highest in the country at well over 2,000 families and their loved ones. And that is what this bill is all about. I just want to read a letter I got back from a family about their loved one, because when I've raised this with the Minister and indeed at the Autism Committees previously, what I refer to as the piece of paper, that assessment of need, I've been told continuously, time and time again, that you do not need an assessment of need to access health services and the service that should be provided. But here's a letter from a GP which was sent to me yesterday, which states that the above child is under the care and treatment of CAMHS. She is currently awaiting a full assessment of need. The delay in diagnosis is contributing to a possible delay in treatment. Please see all the letters attached. The letters attached, Minister, and I won't go into them all, detail the treatment that this young child is not getting because she doesn't have an assessment of need. It's in black and white, and that's one of a number of different letters that I've received over a long period of time, Lascahirlock. So, with one voice, we're saying to these families that you don't need assessment of need to access service, yet the GP's consultants are saying that you do need an assessment of need to access service. And I know, Minister, that you have time and time again when I've raised this, you have challenged the HSE in relation to this, and I want to refer you back to last August in the Dáil when the Labour Party brought in a motion in relation to autism, and where you supported and publicly said that you would support the use of public money to allow people assessments of needs. And I would ask you today, where does that stand? Because in the recent PQs that we have seen, it seems to me that we're still not up and running in relation to the use of public monies to allow people that assessment of need that their family needs. And it's also coming out loud and clear that the assessment of needs, the 6 regional centres that you promised on that day, that they are up and running, but at all different levels at this stage. And we need a push. This is what the disability bill that Senator Clonan has, this is what the families who contact me day in, day out. And I get contacted regularly, Minister, and I'm sure your office is, and I've been in contact with your office about families in Kildare, time and time again, who are coming to me, who are crying, who are saying that their loved ones are not getting the services because they're asked for that assessment of need. And I ask you, Minister, tonight to give us an update on those 6 regional hubs. Where are they? There seems to be differences with every regional hub. The CHO7 one, or the one that's in our region, does not seem to be up to speed with some others, because simply that the assessment of needs, as far as I see, are growing. And people are coming back, and I can send them on to your office, as I've done in the last number of weeks and months. They're basically turning around and saying that there's no money available for an assessment of need. And that is what the bottom line says. I appreciate you maybe not saying that's not true, but I can send you on and I can put them in the public record here tonight that is what's being said to these people. And I know at the last commencement matter, unfortunately, your office said, Minister, you weren't available, and I totally and utterly accept that. When I read it out in the last issue, that was what the reply I got in relation to assessment of need. So that's what I'm getting, Lascahirlock. That's why this bill is so important. That's why we need resources for these families. I support you, Minister. I support the government. I support, most importantly, the families and their loved ones who need this assessment of need, and the government need to act, and need to act now.